Hello and welcome to another episode of the Myos MD Power Panel. I hope everyone is having an amazing start to the week. It's Monday. So before we get started, I just wanted to make sure that my internet's cooperating. Okay, let's see. Can you see me and hear me? Everything good on your side?
Mm-hmm.
Okay. All right. My computer is just slow, I think. All right. So before we get started, I wanted to mention that today's Power Panel is sponsored by Myos MD, the cutting edge nutritional supplement designed to help with healthier aging and reduce anabolic resistance. So if you would like to learn more about Myos MD and the proprietary ingredient, which is Fortitropin, you can go to myosmd.com, myosmd.com to learn more there. And now we will get into today's amazing episode. I'm so looking forward to this topic. And I actually, after posting about it on LinkedIn, got so much great feedback about people interested in this topic. So I just want to jump right in. So could you please introduce yourself, Dr. Ferdinand, and tell our audience a little bit about yourself?
Yeah, so thanks once again, Dr. Swathi. I am Dr. LaReesa Ferdinand. I'm a board certified OBGYN and also an integrative healthcare specialist. And I love when it comes to women's health and how it's evolved. Many of the women that I serve happen to be in this pivot area of perimenopause and menopause transition. And this is a topic that is so on point, so illuminating, and it is getting a wave of buzz. I'm a CEO and founder of a integrative medical practice here in Orlando, Florida. And in short, I help women thrive so they can age with better vitality. And that's what it's all about right about now.
Absolutely. And so today we want to focus our conversation on muscle health. So, as we're going through these different pivots and transition in our lives as women, there's so many, aspects of our health. And one of those, aspects comes down to muscles and how muscles can be, tied to longevity. So, why is maintaining muscle mass critical for women, especially as they age?
I love to talk about things in not only high level, but practicality. At the end of the day, we want to be able to gain or still sustain a certain independence. And to talk about muscle means that you are very focused on living and thriving well. Muscle is a large system, or your musculoskeletal system is huge. And so, therefore, it is metabolically active. It is important throughout all phases of life. And even more so when we talk about women's health, because oftentimes it's overlooked, right? We are focused on, of course, vital signs and area, but the quality of life, like how is your sustainability of how you live today can really earmark how you thrive tomorrow is so essential. So when we talk about anything when it comes to muscle health, muscle building, maintaining muscle, we're talking about what is the quality of life where you can still maintain some kind of metabolic activity and most importantly, independence. And when you have better independence, you can do the things you want to do. People are supposedly living longer, but how are you living? You know, and that becomes a conversation that we need to make sure that we are instilling in our medical community and with our patients.
Yes, absolutely. And it's the change of discussion from lifespan to health span. So it's not only
Mhm.
how long you're living, but what is that quality of life associated with that length of life? Yes, absolutely.
Absolutely. Absolutely. I've even gotten to the point of calling about your well span, right? Because many of the factors that implement within your environment beyond even nutrition, even our generational changes and financial, all of those things input our stressors on different parts of our health, our hormonal health, which we'll touch on, and especially how we move about in our space. So as long as we're able to do that, it's really about being well.
Yes. And so you just mentioned it. Hormones play a key role in muscle function. So let's talk about estrogen, testosterone, and progesterone and how they influence muscle strength, recovery, and metabolism in women.
Yes. So in general, estrogen is our main hormone. It's what helps women be women, right? Men do form a small amount of estrogen, but when it comes to specificity around a woman's composition in her body, I'm going to drill it down to three main hormones, even though it's a hormonal symphony. So there are a couple of things that I'm going to mention probably over and over because I want you to have some takeaways, some things that no matter what, hey, one of those is there is a hormonal symphony. There is a hormonal web that works synergistically. And there's no one size fits all. So when estrogen is one of those main players, we're talking about areas where it's important for protein synthesis. It can help reduce muscular damage that can happen with that natural aging process. And I consider aging a process, not a problem. We make it a problem when we don't deal with some of the things preventively and proactively. Estrogen also helps with decreasing inflammation and helping out with recovery. Then another aspect of looking at this, and I'll specifically talk about the transitions as we get more into our menopausal years or postmenopause, but these are changes that are important throughout our reproductive life that we need to just be more inclined and in tune with. So with your testosterone, we're talking about growth of muscle, helping out with performance, boosting energy, those areas that really do make a big difference. And guess what? Even though it doesn't have the same muscular fibers as your skeletal muscle, your brain is one of your biggest muscle areas where these receptors will reside, and so therefore will impact the other parts of your system. And then progesterone is also contributed as far as performance or exercise performance. So many of the things that are declining or changing with fluctuations that can happen within this hormonal symphony. And as we're impacted in our environment, whatever those stressors are, toxic people to toxic things, can really change as those three hormones or those specific hormones can potentially be impaired because of the decline as we age. And so, therefore, it can cause muscle loss, muscle fatigue, decreased recovery, and inability to burn fat or be more metabolically active.
Yeah, so that's a great introduction to those three hormones. Maybe we can talk a little bit more about each one of them. So let's start with estrogen. So estrogen has been shown to have protective effects on muscle and bones. So what happens when estrogen levels decline?
Sorry, I was trying to make
Oh,
sure I
no worries.
got my
Um,
computer. Oh,
Yes,
can you
I'll
still?
turn it back over. Yes,
Okay,
yes. So,
okay.
estrogen has been shown to have protective effects on muscle and bone. And so, that was a great introduction to those three hormones. But let's talk a little bit more about estrogen. So, what
Mhm.
happens when estrogen levels decline, and how does this impact strength, endurance, and even injury risk?
Yes. So when we talk about estrogen, it has a large part of protective effects, is like I would like to call it. It is part of not only protector of muscle and bone, but as I mentioned before, a lot of estrogen receptors, which are I call it that mitten, and that's the glove, and you're catching the ball. So on our cells, and not trying to go too high level throughout our body, is used to responding a certain way in this hormonal symphony in order to help with decrease in inflammation, help with protein synthesis, help with reduction of inflammation. And so, what happens is many people may, especially when we're talking about women, I'm going to put in the practical terms of what this could look like. And we're starting to use more of the term of what we call musculoskeletal syndrome of menopause, where we're not only talking about the loss of muscle, but the effect of what that could look like. So this is more muscle pain or muscle, what we call arthralgias within the joint or inflammation. And something that is really important as we age is trying to reduce sarcopenia, which is that loss of muscle and more fat deposition. A lot of those things are the protective effects of estrogen, and one of the biggest areas that we're seeing that effective is um, over time, women may have increased risk of injury or connective tissue issues or tears or muscle loss or things that will keep you from the quality of life that you enjoy. It's about being strategy driven, you know, and in order to do so is to stay more aware and informed of these physiologic as well as biological changes. And don't think that it's in your head, because this natural decline that is happening over time has, in essence, a big portion of could be the culprit of what you could be experiencing. And so many of those things need to be, what we're going to touch on a little later, has to be on the forefront of how do we start these discussions with our clinical providers, and how do we address them beyond understanding how do we start this journey so we can live longer.
Yes, definitely. And let's talk now about testosterone. You
Mhm.
mentioned it already, but it's often associated with men, but it's just as important for women, just in a different way. And so, can we talk about testosterone's impact in muscle health in women and why healthcare providers should consider optimizing it for women?
Yes, testosterone is a big component when we talk about anabolic support. This is building just as much as estrogen, but promoting more lean muscle development and reducing fat. And this also contributes to protein synthesis. Protein is one of our major building blocks in our system, in our body. And when we talk about muscle, we're talking about movement, right? So, in order to be able to move and reduce injury over time, therefore, that improves our physical performance. Like I said, it'll be certain themes I want to make sure, no matter what, it's a takeaway today. Testosterone helps with recovery and repair. So when you're exercising, there's a certain amount of um, breakdown in order for you to build muscle and build performance, but you have to be able to recover. So it helps with recovery. It helps with what we call mitochondrial health, and these are your energy powerhouses in your cells. And even beyond just the high level of thinking in that way, you want to be able to reduce the stress and the inflammation in your body so you can, once again, be able to recover and repair and actually see that nice tone, that nice growth from your workouts or whatever you're doing. So, once again, that anabolic support from not only estrogen, but testosterone adds to that. And then also, I like to think of it as reduction of fatigue. Many times is part of that support of that energy or that performance drive that can be difficult sometimes for people to attain or maintain, especially as they're increasing in some of their exercise activity. And that's what a lot of women are noticing. Like, look, I'm at the gym all day. I've signed up for this, and I'm doing all of these activities. And yet, at the same time, they may not be getting some of the gains that they would like naturally, and may need some additional support along their strategy as they age.
Yeah, so let's talk a little bit about, the women who are going to the gym, they're incorporating some maybe resistance training or increasing their protein intake and, all of these things that we hear are essential for muscle health. But what are some recommendations that healthcare providers can use to base, some of their suggestions off of, the hormonal profile, like that personalization of care? But what else in general could healthcare providers consider when it comes to recommendations for women who are active and going to the gym and taking that like integrative approach?
Yeah, I like this question because whether there's clinicians or healthcare providers that could be listening in, or even from the standpoint of a consumer or a patient or someone who is trying to be more informed. I want to break this down in different questions as and answers, or how you evaluate this. And one is to recognize that when someone is coming in for a wellness visit, it's beyond the vitals. It's beyond the chronic disease that you could be managing. Asking certain questions of um, how are, how are you getting up the stairs? Are you noticing certain pains or swelling that you used to not have maybe 1 or 2 years ago? These are some things that you can start asking right away in your for a woman in their 40s and 50s. They don't have to necessarily be menopausal, but at the same time, you're getting into the nature of asking the question, and then also you know what to ask when these things are abnormal or don't seem significant. This is important for a strategy because oftentimes in this broken healthcare system, there's a minimizing of time, and you want to make sure you're addressing your concerns because that helps with treatment and management. Another thing is when we're talking about mobility and strategizing for someone, is really asking in detail, are you experiencing other symptoms, outside of what people may notice with joint discomfort or joint pain or energy deficits or increasing in fatigue? It could be a constellation of other symptoms that relate to more cognitive changes, areas where they feel that they just don't have the momentum or the performance like it used to. So going to like what we talked about at the top, it's about the quality of life that you live. And then thirdly, it helps you really build a strategy when it comes to treatment, because now you've brought along the attention and you're aware. Now you can have more actionable steps and get more into the granular of, okay, getting hormonal lab testing, finding out where somebody is in their menopausal stage by retrieving some of those tests, and then being able to develop options that can incorporate into their medical history, as well as integrating what they can do lifestyle wise. So, whether it's from getting into some resistance training 1 to 2 times out of the week, improving in the nutritional profile, making sure you're high in antioxidants as well as the adequate amount of protein. And that might need to incorporate resources of people helping, because it's not a overnight thing, it's a journey. And then making sure there's appropriate follow-up, making sure there's accountability. So attention, awareness, actionable, and accountability, those are areas where we can really incorporate a more personalized strategy, really change the face of how we deliver medicine, and most importantly, help women and reach their outcomes, because heal women, heal the world is what I believe. And so that can really incorporate more family and community changes as well.
Yes, definitely. And you hit on this a little bit, but I'd love to talk a little bit more about, when we're thinking about lifestyle, so many people right now are just stressed out. And so they have cortisol dysregulation. And so I'd love to hear a little bit more from your perspective about how this impacts muscle maintenance in women, and particularly how it impacts women at these different pivots or transitions in their life.
Yeah, I like this question too because once again, it's there is a hormonal web, but it's impacted a lot about our environment, from toxic people to toxic things and toxic food and our toxic environment potentially. And when we mention stress on our system, the thing is, stress can be very good. I mean, we need it for a lot of sympathetic actions that we take in a day, from, stopping at a stoplight quickly and avoiding an accident, to really making the difference of when those chronic stressors go over time. Then women with the decline of some of these important hormones like estrogen, progesterone, and testosterone, as they're moving into the menopausal transition, and especially postmenopause, that elevated cortisol could be a issue with breaking down muscle, or that catabolic change versus that anabolic, that build, and therefore getting increase in fat deposition in our system, which therefore can increase inflammation, can increase toxins that can accelerate aging. And over time, this can weaken muscle. It can cause issues with how we regulate or metabolize our blood sugars because muscle is a metabolic organ. And it can contribute to some of the depletion and not being able to get the best muscle performance, muscle recovery, and therefore that can lead to inactivity. And we don't want that. So having those lifestyle things that really incorporate mitigating different stressors in our system can really help with having that longevity lifeline over time of moving and having that functional independence that we all want well into beyond 60, 70.
Yeah, and one of the things that I know you've talked about before is hormone replacement therapy or HRT. I'd love to hear your perspective. I know it used to be quite
Mhm.
contentious, the whole conversation around HRT, but I feel like now more than ever it's less contentious, which is great. And so I'd love to hear a little bit about your perspective and then how HRT can play a role in muscle preservation.
Absolutely. One thing about hormone therapy, I feel like it's definitely coming to the forefront where it's hitting on many algorithms and many feeds at this point, as opposed to really, I love it when a woman is trying to find out, okay, is it best for me? And I'm a big one about make an informed decision. Don't make a decision out of fear. Because even though we know a lot of things in women's health and research are needed, and the advocacy in this area is starting to build, whether it's really upon the consumer and the patient of taking that step and making sure that they're getting the opportunities for this personalization of what it can benefit. Because one of the biggest things that we know that we talked about before when we're talking about improving muscle strength and muscle mass retention and the mobility and the performance and therefore the physical function of our muscles so we can be mobile for a long period of time, hormone um, therapy has been a good pivot point of adding those essentials. So once again, for that person that could be doing all the lifestyle changes, but yet are still noticing there's no boost or no improvement in these areas because of the of not having hormone therapy. Those are excuse me, that should be part of a strategy that can be implemented. So I'm very much in support of there's no one size that fits all, but what we do know is that it can be done effectively, it can be done safely, and right dose and right timing, especially within 10 years of the menopausal transition, can be very pivotal for not only improving cognitive and vasomotor symptoms, but also when it comes to muscle health. So, with that, you can have a combination of therapy of estrogen, testosterone, and progesterone. Progesterone oftentimes may be used for some of the other benefits for endometrial protection for women who still have a uterus, and may still be used outside of that, depending on what's the personalized benefit of what it can be, because it is part of a anti-inflammatory response to the body as well. I'm a big proponent of making sure that if someone is on it, following them on it based on KPIs, key performance indicators. Um, if we're if we're managing dose, if we're managing response, and this is not a okay, I see you next year and I refill your prescription in 6 months when it comes through the computer. No, this is, hey, we need to make sure we're following up your response, make sure identifying what are dosage changes and experiences that people are getting. But most of all, looking at the comprehensive approach of what hormone therapy can be able to benefit most people. Because if you're talking about muscle health, then it goes in line also with bone health, brain health. So it can have a collective and corporate benefit for a woman, and really targeting in areas where um, it if muscle health is definitely part of the game of women becoming and maintaining and sustaining metabolic and movement independence is definitely something that needs to be evaluated in an informed decision model and a patient-centered model, so there's no fear around it and that a patient feels comfortable with that decision.
Yes, and as we're getting to the end, I wanted to ask, if healthcare providers, that are listening, maybe they're listening to the live. We have a lot of people that tune into the recording. So, what is one key takeaway that you would like a healthcare provider to, be able to take into their practice as it pertains to women's hormones and muscle health?
Awareness and bringing it up. I find out so many women where they're just maybe going to their doctor once a year or maybe twice a year, and that education or that exchange is just not happening. So I think it should be just like if we are evaluating someone, if they smoke or if they have some type of alcohol dependence or drug use, or these are major areas that are evaluated outside of medications list when someone comes to their clinician. So what would the world look like if this is part of a evaluation question each time and digging a little deeper to further make sure that you can partner with a woman throughout this time. So I think the biggest thing is to just bring it up, talk about it, make sure that the elephant in the room doesn't maintain the elephant room for visit in and visit out and leave them to their own devices with a Dr. Google search. So it's better that we bring it up and educate so we can start doing something about it and be more proactive and preventive.
Okay, amazing. So as we wrap up, we'd like to thank Dr. LaReesa Ferdinand for being our guest and to Myos MD for sponsoring today's power panel. Fueled by our revolutionary ingredient, Fortitropin, Myos MD is trusted by healthcare providers nationwide to deliver real results backed by science. If you'd like to learn more, you can go to myosmd.com to learn from experts like Dr. Ferdinand. We have a number of other discussions on our website and on YouTube, and, really tangible takeaways like today's conversation. So you can bring, this powerful solution to your practice. Okay, great. Well, thank you so much. Is there any way that, our listeners can learn more about you or follow along with what you're doing?
Yes, absolutely. So here on LinkedIn, my profile is just how it reads here, Dr. LaReesa Ferdinand. Or you can follow me on Instagram at Dr. LaReesa, DrLaReesa.
Okay, well, thank you so much and have a great rest of the week.
Thank you. Take care, Swati.
Awesome.